Good afternoon. Thank you for joining us this afternoon. We're going to have a little bit of a different order today. We're very pleased to be joined by two guests that will present an update that's very important, not just to our state, but I think it's going to be, in terms of a national conversation, very important for us all to be able to share, not just the results here in the state of Indiana, but this is almost kind of a how-to manual going forward. And so in just a few moments, we'll hear from the Dean from Fairbanks School of Medicine, Dean Halverson, and then we'll also hear from Dr. Minna Kimmy, and they'll talk about the project that's forthcoming. In the meantime, so Dr. Box, if you would, we'll defer to Fred Payne at the Department of Workforce Development for some workforce numbers. It's Thursday, so those are very timely. And then also, I just wanted to say, we had a question yesterday from Nikki Kelly, I think it was, from Fort Wayne, the Journal-Gazette, and she asked about PPE, the personal protective equipment, and our inventory, what we had purchased, what we had ordered, what's here. And we'll have a full report on that tomorrow, and we'll deliver that. So with that out front, those housekeeping items to the side, Fred, you want to give us the latest on our workforce development numbers?
Yes, I will. Good afternoon. Our weekly claims for unemployment continues to drop. We've seen a decline this week, much from our peak in March of this year. For our week ending April 28, 2020, we saw 75,473 claims filed for the week. From a historical perspective, this actually triples our previous peak before March of this year. Although we're seeing a high number of claims being filed, we're also seeing a high rate of payments being made. We're making record number of unemployment benefits payments. We've made a total of 1 million unemployment insurance payments in the month of March. And that's to about 350,000 people. And this also includes federal payments. We've had a total dollar amount of those payments that equals about $470 million. That includes the $359 million in pandemic unemployment compensation, the $600 add-on that we started paying out on last Friday. We continue to work on concerns with our call center. We fielded over 1 million phone interactions over the past month. So we continue to have extreme call volumes, and we're constantly making adjustments and improvements on a day-to-day and week-to-week basis. We'll continue to make those adjustments. We want to make sure that we're reducing our call wait time. We understand that that is a huge issue when it comes to a high call volume system. But we also want to make sure that we're empowering claimants to utilize the self-help tools that are available to them on our website. And looking at the top reason for why a person will call in, it's a reason that falls into what we consider the general questions category. And when we look at the general questions category, those questions fall into 4 areas. Questions regarding the CARES Act, the Pandemic Unemployment Compensation or Assistance. What do I do when I'm laid off? How long will it take to receive a payment on my claim? And how much will I be eligible to receive in benefits? Those are all questions that fall into that general category that we get quite a few calls about. All of these questions are typically answered with our self-help tools. The cumulative amount of time that it takes, including the wait time, to answer one of those questions for several thousands of people is massive. Each call that could be handled through self-help but is not adds to the wait time for another caller who cannot utilize self-help to get an answer to their questions or to resolve an issue. So we want to make sure that we're continuing to put information out to the general public so that we can help people be empowered to find the answers on our website prior to having to go through the inconvenience of calling in and experience the long wait times. But while you're doing that, we want to assure you that we are continuing to do everything in our power to make sure that we reduce those wait times. Some of those things include changing coding to computer programs, providing more staff, training more staff. Those things we believe will have a dramatic impact over the days to come on that call wait time. We'll continue to be as aggressive as we can in sharing information to the general public about unemployment issues and unemployment claims and filing. Over this past week, we've already had several webinars, we've had several public forums, and we will continue to do that because we believe that the more information that the public has on our unemployment system, the better he or she is able to navigate our system. So now I want to talk a little bit about our pandemic unemployment assistance program that I provided an update for last week. As you may recall, this program is a new program for those individuals who would otherwise not be eligible for unemployment benefits. Those individuals who may have a limited work history, those who are self-employed, those who are independent contractors or gig workers. The PUA benefits also include the additional $600 a week in payments above and beyond whatever dollar amount the person is eligible for. As a reminder, we had to build a new system from ground up. So starting tomorrow, on April 24th, we will begin accepting applications for PUA. Tonight at 7 p.m., we will take our unemployment system uplink offline to make this system update. We've targeted payments to begin on May 8th for PUA. As a reminder, these claims will also take about 21 days to administer. So just because a person files on May 7th doesn't mean that a payment will be forthcoming on May 8th. So we want to ensure that people are patient and people understand the process. And while I'm talking about the 21-day wait time, I do want to share a story about an individual who filed a claim on a Monday. The individual filed a claim on a Monday, and then on Wednesday, the person called in to check on the claim. And when asked why they called in, the person said, well, I just wanted to check on my claim. And we provided the person with all the self-help tools necessary, and the person continued to, began to utilize those self-help tools. So that reduced a little bit of frustration from that person from having to call in and sit through some of the long wait times with our extreme call volume. So when a person files, keep in mind that it is a 21-day average period. And the key word there is average. There are some claims that get paid out in 13, 14, or 15 days. Others may go beyond 21 days. It just depends on the situation that that person's in at the time. Finally, I want to talk a little bit about our job availability and our continued responsibility to connect individuals to job training and to jobs. As a reminder, right now, our primary focus is making sure that we provide benefits to every eligible individual in Indiana under our unemployment compensation system. However, we still have a responsibility to ensure that we're connecting people to jobs and connecting them to resources. So I want to remind you that we've had virtual job fairs and we'll continue to have those. We had one virtual job fair on yesterday in Northeast Indiana in the Fort Wayne area. We had 5 major healthcare systems and hospitals that participated in that job fair. We do have quite a few coming up here. On April 28th, we have one for the Bloomington area in healthcare. On May 5th, we'll have another virtual job fair, and we'll have about 5 or 6 employers who will be engaged in that, and that will be for Eastern Indiana. And on May 6th, we'll have a virtual job fair for General Motors in Kokomo, where they'll be manufacturing the ventilators, and they'll be looking to fill 1,800 full and part-time positions. If you want to know a little bit more about the virtual job fairs that we're going to have, please go to dwd.in.gov and scroll down to the DWD News section. We also have a variety of online materials to assist in self-help. We have updated frequently asked questions, as well as other important information that could help you. These numbers, all in all, indicate that Indiana, just like other states, are seeing a massive number of unemployment claims filed. Hundreds of thousands have been filed. But we're also ensuring that hundreds of thousands of Hoosiers are receiving the benefits and payments that they are eligible for. But we know that we can't stop there. We continue to upgrade and adjust and to improve our systems so that we can make sure that we're paying more Hoosiers in a better way. Thank you, Governor.
Fred, before you socially distance yourself, will you, you mentioned numbers. You're a numbers guy. It's easy to get lost in the numbers or the columns. Will you just put a finer point on the difference between claims and people?
Okay.
Payments out to people and payments to claims.
Okay. So that number that I report, the initial claims filed, that represents a person who filed a claim under our unemployment compensation system. When I indicate that there are payments made, any individual claimant can receive multiple payments. So for example, if an individual filed a claim, let's say in March, but they didn't receive payment until the mid part of April, they can receive back pay for all of those weeks that they were eligible. They may ultimately receive those checks on one day in one setting, or they could receive them in several settings, but they could ultimately receive more than one payment.
So we're now 300-some thousand people.
Right, we're at about 350,000 people receiving payments.
Yep, perfect. Well, don't go far.
Okay.
I mean, go 6 feet, but not far. I suspect you'll be back. Next, we'll go right to Dr. Box for our latest on the ground.
Thank you, Governor. Good afternoon, Hoosiers. Today, we reported 612 new cases of COVID-19 and unfortunately an additional 45 deaths. This brings to the total of number of Hoosiers who are known to have COVID-19 to 13,039. A total of 706 Hoosiers, unfortunately, have lost their lives to this disease, which is about 1% of all the individuals who have been tested positive here in the state of Indiana. Today's totals include 2,594 new tests, which many of you recognize is lower than some previous days' totals. If we're going to be able to increase testing in our state, it is of the utmost importance that we work with our hospitals, our local health departments, our federally qualified health clinics, our community health clinics, and other providers to begin transitioning to outpatient testing for any patient experiencing symptoms suggestive of COVID-19. That way we can reach out to positive individuals and make sure that we trace all of their contacts and help to prevent the spread of this disease. As I mentioned previously, we'll be adding clinical diagnosis and deaths to our dashboard soon, but I want to continue to encourage healthcare providers to test individuals who have symptoms that are consistent with COVID-19 if they have the resources to do that. That way I can find out about the case earlier, and then once again, we can do the investigation and trace the contacts. I want to follow up on a couple of items that came up yesterday. First, I want to clear up the issue with regards to saline and the swabs that I described or related to Q-tips. The FDA announced on Tuesday that it authorized the first test for patients to self-collect samples using shorter polyester swabs that are about the size of a Q-tip and submit them to LabCorp for testing. These home collection kits are expected to be available in most states with a doctor's order in the coming weeks. This is very exciting because it will expand our testing options by providing different swabs and removing the need for viral transport media. To date, the State Department of Health has been able to purchase over 50,000 swabs. Eli Lilly has donated 32,000 swab kits. We have been given 4,000 swabs from our generous donors, and FEMA just provided 20,000 swabs that we are using to make testing kits. We know that the need is much greater, so we expect that the new home testing kits will be very popular. These kits will also be less invasive than the nasopharyngeal swabs, but it's also important to remember that these tests work best when an individual is symptomatic, because the shorter length means that they are less sensitive in the lower part of the nose. My team made me provide this clarification so that there isn't a run on Q-tips and contact lens solutions in the coming days. The other item I wanted to follow up with was some questions that came up with regards to closing McDonald's lobbies. The Indiana State Department of Health has not ordered the closure of any restaurants' lobbies. We have issued reminders that critical industries should follow social distancing guidelines and allow carry-out, drive-through, delivery, and pickup orders, but no in-person dining. Local health departments, however, do have the choice to be more restrictive than the state executive order if they choose. Finally, today I'm very pleased to announce that we have partnered with the IU Richard M. Fairbanks School of Public Health on a scientifically designed study that will examine the prevalence of COVID-19 among Hoosiers. This study will also give us better understanding of the extent to which individuals are showing antibodies that indicate signs of past infection. We believe this data will better inform our plans to safely reopen our state and to determine what new normal mode of operation really looks like. Starting Saturday and running through next Wednesday, we'll begin testing selected Hoosiers who were chosen through this scientifically designed study to ensure that they accurately reflect racial, ethnic, and geographic demographics of our state. We have started reaching out to people today, and I hope that if you are contacted, you will agree to participate. We need your help to make sure that the data that we receive accurately reflects Indiana's population as we use it in decision-making for our state. I want to thank you ahead of time for your participation if you are chosen. I also want to thank IU Fairbanks, Indiana National Guard, EMS partners, Indiana State Department of Transportation, Eli Lilly, IU Health, Ivy Tech, Walmart, Zotec, and Maximus for their assistance and leadership on this project. It is now my distinct pleasure to introduce Paul Halverson, the founding dean of the Richard M. Fairbanks School of Public Health. Dr. Halverson is a past state health officer in the state of Arkansas, and he has been a consultant, a mentor, and most importantly, a friend to me since the first week that I started this job 2 years ago.
Thank you, Dr. Box. It's great to be here. I want to express our gratitude to both you and Governor Holcomb for leading Indiana's response to the COVID-19 pandemic. I just also want to say how appreciative we are to both of you for your evidence-based approach to the state's response to this pandemic. As Dr. Box mentioned, I'm Dr. Paul Halverson. I'm the founding dean of the Indiana University Richard M. Fairbanks School of Public Health at IUPUI. I'm especially appreciative of being able to describe to you the work that we've been doing. We were founded in 2012, and the Fairbanks School is committed to protecting and advancing the health of Hoosiers in Indiana and beyond. In the last 8 years, our faculty and staff have responded to public health and health administration issues with evidence-based research and practice, from the opioid and tobacco crises to rising healthcare costs, from developing maternal and child health interventions to leading a large-scale response to chronic diseases like diabetes. We've been on the front lines of public health and health administration, and we appreciate the opportunity to bring both research and practice to Indiana to support our partners in public health. We're also pleased to support Indiana's local public health departments through hosting the Local Health Officers Association in Seicho, as well as in training individuals who will be our public health leaders of tomorrow. In addition, we're proud to work closely with both Dr. Box and her leadership team here at ISDH, as well as Dr. Kane, our local Marion County Health Officer, all of whom, by the way, I think are doing an incredible job supporting our state through these very challenging times. We believe this close partnership between the school and our public health agencies is incredibly important. It brings important value to public health effort in Indiana. Since the emergence of this virus, our school has been supporting the state's response to COVID-19, working with public health officials and hospital leaders, including the Indiana Hospital Association. We created forecasting models to predict the spread of COVID-19 and to understand the needed hospital surge capacity for the state. With this knowledge, we developed capacity planning models for hospitals and health systems. Now our school is helping to lead an initiative that you'll hear more about regarding random sample testing across Indiana for the virus that causes COVID-19 and its antibodies. I'm pleased now to introduce my colleague, Dr. Nir Menachemi, who will be leading this population health scientific testing effort. Dr. Menachemi is the Fairbanks Chair of Public Health and leads our Department of Health Policy and Management. He's also a scientist at the Reagan Street Institute and is one of the most widely respected health services researchers in our country. His research has led to numerous organizational and societal decisions that have made enduring contributions to improving people's health in Indiana and beyond. Nir?
Thank you, Dr. Halverson. I am pleased to lead the scientific team in our partnership with the state, which includes multiple agencies and private organizations that Dr. Box mentioned. The team from the Fairbanks School includes leading biostatisticians, epidemiologists, informatics, and clinical infectious disease experts. Together with the state, we are taking a critical step towards understanding how COVID-19 has affected the population of Indiana. I want to highlight an important distinction in how this testing initiative differs from existing testing endeavors. To date, almost all of the testing that has occurred has come from patients with serious symptoms or other high-risk individuals, including our frontline healthcare workers and essential employees. Existing tests were purposefully focused on clinical or congregate settings to support clinical decision affecting individual patients. Because these tests focused on sick and high-risk individuals, we lack an understanding of how many people in our state have been infected, especially if they were not formally tested or had no symptoms. This is where our work comes in. We will obtain scientifically valid results of the proportion of state residents that are currently infected, regardless of symptoms, and those that may have already been infected with the virus based on antibodies. We will finally obtain an understanding of the true prevalence of COVID-19. The individuals we will test have been selected randomly to represent everyone in the state above the age of 12. Each selected individual will be asked to volunteer their participation with parental approval as necessary. Those agreeing will provide both a nasal swab to test for active viral infection and a blood draw to allow for antibody testing. Whereas existing tests have supported clinical decisions of individual patients, our approach will allow for a community-level understanding of the virus's impact. This will enable better evidence-based policies, including the complex decisions surrounding social distancing orders. As mentioned, we have identified a representative sample of Indiana residents by randomly selecting people in each district of the state from a list of all residents. Our randomization protocol was carefully calibrated to ensure the ability to draw conclusions about the impact of COVID-19 by each of the state's districts and by sex, race, and ethnicity, as well as the overall rate for the state. For this reason, if you are selected, please consider participating so that your community, however you define it, can be represented in our data. Our overall plan is to conduct multiple waves of data collection that will occur months apart. Wave 1 will start immediately and provide critical information, including establishing a baseline. Each additional wave of testing will allow us to examine how changes in the prevalence of the disease is progressing in Indiana and how it's affecting the groups I just mentioned. For each wave, we will enroll between 5,000 and 7,000 individuals statewide. In order to adhere to the scientific protocol, only those contacted by ISDH will be able to participate. Unfortunately, we will not be able to test others at these drive-through testing locations. Before I turn it over back to Dr. Box, who will describe the logistical and operational plan, I want to reiterate the importance of our study in determining the true count of infections, including mild cases, which represents important information not currently widely available in any state. By being one of the first states, we will get a head start in understanding the epidemic's true trajectory, identify and address disparities, and be able to make wiser decisions on how to deploy our limited resources. Thank you, Governor Holcomb and Dr. Box, for your leadership during these challenging times. We look forward to playing a part in advancing Indiana towards a sense of normalcy. Dr. Box, back to you.
Thanks, Dr. Menakemi. So we will be doing sampling at 8 fixed drive-through sites across the state, which you can see here in red, and there will be 10 mobile RV sites that will go to all of the areas in blue, hopefully bringing us close to everyone that is selected for this particular study. We're very grateful to our community partners who will be providing sites such as Ivy Tech, Walmart, the Teachers Treasury here in Indy, the Healthy Beginnings in Elkhart, Ascension at St. Vincent, and Parkview Health. We also are very grateful to our workforce medical workers who will be the phlebotomists and our paramedics from the National Guard to take the blood samples, and EMS providers who will work to collect specimens. I really wanted you to see this slide because it really truly does take a village to pull off something like this, and we are grateful to everyone who is contributing to their part for this study. Every participant who has been chosen will receive a postcard and a phone call. They may potentially, if we have an email up to date, or they may receive an email or even a text message. You will be asked on the phone call demographic and medical information, and I promise you that you will receive complete privacy and that we will protect that privacy. You will also be able to go to a website to register, and you can choose on the website the time most convenient for yourself and the location closest to you. When you arrive at the test site, if for some reason you have not been able to register online, you can actually register at that time. And we will be obtaining a swab of your nasopharyngeal area, and also we will be doing a blood draw at that time. Unfortunately, if you had not been chosen to be a part of this study, we will not be able to test you at that time. Lastly, I just want to say, please help us with this study. If you're chosen to participate, please do so. The validity of this study really depends on us having an accurate representation of all Hoosiers all across our state. Thank you.
Thank you all. This is exactly the kind of Hoosier innovative thinking and action that we're known for. And as I understand it, not only are we one of the first in the country to do this, but I would put this study and project in terms of thoroughness up against any other project that we've been looking at around the country. So proud of what this is going to represent and allow us to not just contemplate, but to include in our decision making. It's exactly our approach every single day. Data drives our decisions. Today, will next week, will next month, for the rest of the year. So this is exactly symbolic of our approach in general. Also, just very quickly before we get to questions, you heard a lot of information there, a lot of substance that I'm sure will require some follow-up. But I did want to mention, it came up yesterday a couple different times, the importance of food banks at this time. We're up about 154% in terms of food distribution out of our food banks and pantries all over the state of Indiana. It's about 450,000 meals, food that's being distributed just last week. Just to put that in perspective, all over the state. And when I say all over, we're talking about small, medium, and large pantries and banks, and the Guard's been very instrumental in helping kind of connect dots all over the state of Indiana. But just to give you a little bit more perspective, food bank up in northern Indiana in South Bend, thanks to Mario and his team, you know, they're packing 5,000 boxes each week, 2,000 bags, and getting those out to LaPorte and Marshall, Kosciuszko, Elkhart, Stark, and St. Joe counties. So a big, big reach there. In Lafayette, the Food Finders Food Bank, thanks to Katie and her whole team, up that way, they're doing amazing stuff when people are literally coming in saying, I just paid for my last meal. Yeah. What's next? And again, this is on a scale like we've just never seen before, no matter where you're from in the state of Indiana. In Muncie, they got the Second Harvest Food Bank of East Central Indiana. So again, not just Muncie, but thanks to Tim and his team, they're actually not just feeding stomachs, they're also feeding minds. And so they've taken this opportunity to also distribute chapter books for summer reading projects. So we're hitting you from, you're talking about your mental wellness and you're talking about your physical wellness all in one, stop shop. In Indianapolis, where we find ourselves here now, they've got, of course, Gleaners, who's been around decades, and they're doing about 65,000 households a week. To put that in perspective, on top of Midwest Food Bank, led by John Whitaker, they're doing about 18,000 households per week. Food Bank up in Northwest Indiana, I talked about them a couple weeks ago, doing about 4,500 households per week. Dare to Care in Clark County down in the southeastern, you heard from Indiana, you heard from the mayor down there in Jeff yesterday. Down in that region, they're doing about 4,000 households per week. Community Harvest up in Fort Wayne, and it's not just Fort Wayne, it's the kind of the northeast quadrant of our state, about 3,500 households per week. So this is, and again, those are kind of, the urban areas in those parts of the state, but they've got tentacles out into all the different communities throughout the state. So thank you for everything that you're doing to get folks from one day to the next. And we're proud actually to be partnering with on a scale like never before through our Indiana National Guard and the Department of Transportation, the Department of Health, everyone. This is truly all hands on deck. And with that, I'd like to call Fred Payne back up. No, I'm just, Rachel, you want to get the first question teed up?
Eric Berman,
Yep.
WIBC.
Good afternoon.
Hello, Governor. Couple of questions for the doctors in the House. First, I wonder if Dr. Maynard-Chamey could elaborate a little bit. What will this study do that we don't already know? We already know from state and national data that there are racial disparities and gender disparities. Can you give me a couple of examples of how this sharpens our response to the virus? And second, for Dr. Box on the more immediate testing, adding up the donated and purchased swabs that you were listing, that's 106,000 swabs. What is it that's preventing the state from ramping up just the day-to-day testing of symptomatic individuals? If we've got that many, how do we get those out to the places that need them?
Thank you. So I'll take the first question. As I mentioned, right now, all the testing, or the vast majority of the testing information that we have, is from people who are either sick or high risk. And yes, you are correct. We do know there are many disparities by race and ethnicity especially on who ultimately is hospitalized and how bad the virus hits them from a health perspective. What we don't know is how bad each community within our state is infected or has been infected. Again, if we're only testing people with the most serious symptoms, it seems like we're only looking at the tip of the iceberg. What our study allows us to do is look below the water and see the entire iceberg and try to get a sense of how large it is and how it's affecting different communities perhaps differently.
And Eric, the swabs that we have been paired with viral transport media. We've given them out to hospitals, to local health departments, to coroners, to all types of individuals across the state so that they can be used. And the ISDH team with our strike teams, we keep some of those back so that we have those regular tests that we need to test individuals as we go out to the long-term care facilities, the prisons, the meatpacking plants, or wherever we're needed any particular day.
Jeff Smith, WLFI.
Good afternoon, Jeff.
Good afternoon. I'm going to revisit a question that I posed on Tuesday when I asked about Cass County's numbers in terms of cases and testing. Dr. Box suggested the testing there was robust and she was satisfied with it, and then mentioned a facility, but not by name, as a plant, I think, or a factory. And Governor Holcomb, you said that you'd spoken to that plant CEO that morning and assured everybody on this call that that was a safe working environment. Now, 24 hours after that news conference on Tuesday, we learned that the state was putting $100,000 towards Cass County for testing. And about 3 hours after that, we learned that Tyson had closed its pork processing facility in Logansport. So how do you square the information that we got, the public got, during this news conference on Tuesday with the realities of what the state learned on Wednesday?
Please allow us. You take the first half, I'll take the second.
So what I will say to you is that I think there's a total now of about 160 individuals that are positive from that plant, and that number changes a little bit. It was 140 yesterday, I believe. And that's out of 2,100 individuals. So at the time, there was first like 5% of individuals that were actually infected in that plant. When we saw that number go up to about 10%, and I'll be very honest with you, in discussions that we had with Logansport Memorial Hospital, with the local health department, with the county commissioners, and with the plant itself, there was just, even after they closed and cleaned and they put up dividers and made sure that there was the ability to socially distance, still just a lack of comfort with individuals that were asymptomatic going back to work. So we're actually up there with them today and tomorrow, and we'll be testing all individuals in the plant, and with the hope that negative individuals would be able to return to work at the beginning of the week.
Yeah, so Jeff, she kind of answered my second half. The company has made those changes necessary, but as Dr. Box just said, we want to make sure that folks feel comfortable going back to work. The company is 110% in agreement with that, and so we will do just that.
Brianna Cooper, the Indianapolis Recorder.
Good afternoon, Brianna.
Brianna, you should be able to speak. We'll return to Brianna. Sarah from WNIN.
Afternoon, Sarah.
Good afternoon. This question is for Dr. Box. With regard to antibody testing, there are health clinics in southern Indiana pursuing these tests for patients. Their source is not the FDA-approved source. Would you discourage this completely or merely advise them about the test shortfalls? And then also, should the lab they're using become FDA approved, would you count those positive cases or maybe have the patients retested?
So I think if the test that they're using is FDA approved and is shown to be sensitive enough and specific enough, I would have no problems with them using that. I think the biggest concern that's out there is, what does that really mean if you have the antibody? Does that antibody actually give immunity or protection against getting this disease again for 8 weeks, 12 weeks? Half a year, or forever? And no one really knows this, because I always go back to pointing out this is a novel coronavirus. So we can surmise that it may give lasting immunity, but then it could be just like our influenza, where we get different strains at different times, and you need to get that immunization, that vaccine on a yearly basis. So it's hard for me at this point in time, without good scientific data to base that recommendation, to tell someone what their test really means at this moment in time.
Rich Nye, WTHR.
Hello, Rich. Good afternoon.
Good afternoon, Governor. I saw your Facebook post, and I would like you to reflect on the passing of your high school basketball coach, Ed Siegel, and also particularly from the standpoint of more and more of us knowing someone who has died from coronavirus.
Well, Coach was a pretty special person to anyone who ever met him. You didn't have to have him in class or have him yell at you on the court to have developed the bond like so many did with him. And he continued to give to the whole state. I'll tell you a story that really speaks volumes about him. Number one, he could slap the court louder than anyone I've ever seen in basketball. Two, when the Indiana High School Basketball Hall of Fame was an idea and they were looking for people to stand it up and build it, over in Newcastle, they went to Ed and said, "We'd like to hire you to help us make this dream a reality." And he said, "I'll do it on one condition, and that's that you don't pay me." And that was him. And for someone who just enjoyed, whether it was, going to class, econ, which is a class that everyone wanted to take, and it probably had more to do with him than even the subject matter. We all learned a lot, but he was someone who just got you to try to achieve more than you believed maybe at the outset that you could. And those are the kind of teachers. He's not alone. I mean, I had many of them, and I suspect most people did too. But he was the kind of individual that maybe believed more in you than you knew you had in you. And so it was a pretty sad day. Saddest of all for me is that we're going through this and loved ones can't be close. And that makes it tough because people would have drove from, I suspect, countries, or certainly other states, to be as close to Coach Ed Siegel as they could be. And then for me to, just one last thing, for me to, you know, when you're growing up and you have a teacher or a mentor like Ed Siegel in your life, you kind of see them through your daily interactions. And again, he was a guy that, you know, referees knew his reputation before they ever were on the court. And he could be a tough guy. And but to learn later in life that he was volunteering at church, parking cars, it showed he had so much of another side to him that just was even more endearing. So we're going to miss him, but like I've told some others, I'll continue to work every day not to try to let him down.
Brian, ABC 57.
Hello, Brian. Good afternoon.
Brian, you have to unmute your own microphone.
I believe it is now unmuted. Can you hear me, folks?
We can, indeed.
Excellent. Thank you. I appreciate that. Dr. Box, a question for you. You mentioned yesterday that the number of confirmed coronavirus cases in Indiana nursing homes, but the families and even employees are telling us they have trouble getting information on COVID clusters in long-term care facilities. Does state law require public notification of cases in those facilities? And if not, why not?
Dr. Dan looks like he's making his way to the podium before you're going to be able to weigh in here. But
I won't comment on the state law since that one's outside my expertise, but I'll comment a little bit on what we're doing and why we think it's important in terms of communicating with families. So we agree that that's the most important person that needs to be communicated with. And so the original CDC guidance that came out clearly asked all the long-term care facilities to identify one person in their facility who would be responsible for communicating the COVID status of that facility to families and to the residents. We have followed that up with our own guidance, the same, and right now are working with Lynn Clough, who is the state ombudsman director. We will be putting out guidance on Monday to all the long-term care facilities on how they are to do this. We will be following up when we hear that there might be complaints from families that they're not getting that, to make sure that indeed that resident's representative is being told of the COVID status in a facility, and particularly if that status has changed. And I also think it's incredibly important that in addition to the residents that are in that facility, that for those people who would be coming to a facility as a new admission or as a transfer, that they also need to know the status of the facility in regards to COVID.
Victoria Ratliff, the State House file.
Good afternoon, Victoria.
Good afternoon, Governor. My question is for Dr. Box. It's got a couple smaller questions in it, but Indianapolis and Fishers both announced that they're conducting their own local testing. Do you know of other local governments doing testing as well? Is the state competing with some of these local governments for testing supplies? And is the state letting down local governments in any way by not being able to conduct testing on a larger scale?
So I hope we're not letting down local governments by not doing that. I mean, we have testing that we do as the state, but I have encouraged testing all over the state from all different kinds of labs. I welcome any local government, local health department, community health clinic, FQHC, hospital, and many of them all across the state are doing testing. In fact, we are putting together a map right now of all places where you can get tested across the state so that I can identify any gaps. So that partnership, I think, is critical as we go forward, and that ability to be able to test individuals if they have any symptoms whatsoever of potentially COVID-19, that they can be tested.
Yeah, and I'd take it one step further. You play this out. I mean, we talked earlier, and things change by the hour or the day. But just envision into the future, there will be, and as we see plans come in from different companies, they will build this into their business plan to not just take the temperature of folks coming in or leaving or throughout the day, but also testing. So your healthcare provider right now is directing you to get tested long before COVID-19 ever showed up on the scene. So this is bravo to Indianapolis and to Fishers and to other communities that are saying, let's partner on this, let's do more, not less.
Megan with Eyewitness News.
Hello, Megan, good afternoon.
Hi, afternoon, Governor. Several nursing homes in the state, including one down here in Newburgh, they have seen a huge number of cases. From the state's point of view, is this something that just has to run its course, or will the state step in at some point to move residents or to close down some long-term facilities?
So I'll start that question and let Dr. Dan finish, but we don't ever just let it run its course. I mean, immediately upon any facility contacting us, we are there within 12 to 24 hours with our strike team doing testing, helping them on their infection control and cohorting patients. So I know, Dan, you might want to take that further.
And in addition to helping facilities identify new cases, we also are providing testing so that we can test not just the residents who are symptomatic, but all of the residents in the area that might have had a similar exposure. And that's going to allow a facility to appropriately know those residents that have COVID-19 and those that don't. And that is really step one in mitigating it, that the term we use is cohort, that we cohort them appropriately based on their COVID status. In terms of transferring, a lot of times that's going to depend on the individual facility, the local hospitals, the local health departments, and us having discussions around that, because it's not as easy just to say I'm going to transfer folks from one facility to another. There is aspects of that we would want to make sure, number one, and we would work with all the long-term care facilities, that the receiving facility is appropriately staffed in terms of PPE, that they have the ability to appropriately cohort residents if they're receiving those that are negative and they have positives in their facility, or if they're receiving folks who are positive and they have negatives in their facilities. In addition, before anyone would be transferred, we have offered and will continue to offer that we would be able to make sure that they were appropriately tested so that their COVID status is known before they're moved from any facility to another.
Sherry with the Indianapolis Star.
Yes, Sherry, good afternoon.
Good afternoon. Thank you very much. This is a question for Professor Minicini and then for Governor Holcomb. My first question is, what is the time frame for completing the first wave of the study? And then Governor Holcomb, given that you said that you're going to allow the study to help inform your decisions, I mean, obviously the study's not going to be done tomorrow. How are you going to, is there any way that, are you going to wait for the first wave to be done, or will you sort of move ahead without it? How do you kind of finesse that balance between knowing the data is coming, wanting that data, and just not having it today?
Thank you for the question. So wave one will start immediately. In fact, calls and text messages and postcards are already in the mail to our knowledge. And so we're going to start actually drawing samples on Saturday, and we'll continue into early next week. Once all the information is back to us, which will not be more than a couple of days after that, it will only be about 3 days after that we'll have some preliminary results to share with Dr. Box and the governor.
Yeah, and I would just say, look, we operate every day with more information. And as I said, it changes not 5 days from now, but 5 minutes or 5 hours from where we are right now. Same true in 49 other states and 5 territories. And so we're all going through this novel or new experience together. And of course, this virus is vexing, and it makes you step back and want more and more and more information. Fortunately, we're on the path where we're getting more and more and more information, and we'll have a lot more 5 days from now. We'll have a lot more 5 weeks from now and 5 months from now. But we're not waiting to act. We're making the decisions with the facts that we have. We don't just make them up. By the way, I did bring in, you teed this up, you didn't know that, but I did bring in my crystal ball today, just to make it maybe a little easier to go to answer questions. But when you're faced with making a decision, the first thing you do is you reach out to the experts and let the data drive the decision with all the facts that you have.
Cassie Garrett, Whitewater Publications.
Hi, Cassie. Good afternoon.
Hi, how are you?
I'm doing great. Yourself?
I'm good. Thank you so much. My question is for Dr. Box. Dr. Box, as you've talked about ramping up that testing in the local counties and with local health departments, and the state's really given a platform for that to be made possible with the different Okra grants and things like that. For counties that do want to do that, down in our end of the area is Franklin County and Union County primarily. Mm-hmm. How can they go about that? I mean, who's the best person for them to reach out to and say, we would possibly like to test here because we don't have labs. So how can we achieve that, and what should we apply for with these grants?
So I think if you have questions, concerns about what grants are available, I have no problems with you reaching out to the Indiana State Department of Health, and we will be happy to connect you to the appropriate agency here within the government to be able to connect with those grants.
Sam Quinn, the Indianapolis Business Journal.
Sure. Hi, Sam. Good afternoon.
Hello. My question today is related to the state budget. We've seen the cost-saving measures OBM sent out advising for hiring freezes. I'm hoping someone can sort of explain the rationale for which departments are going to be allowed to continue hiring. And then as a follow-up to that, have any state employees been furloughed or laid off, and is that being discussed?
Chris Johnston with the Office of Management and Budget. No employees have been furloughed, but as part of the cost savings memo that you have seen, we have put a hiring freeze on, and so we are conscientiously looking at our hiring practices and what positions need to be backfilled. Obviously, there are agencies that are on the front lines with fighting the virus, and so we will take particular care in looking at their staffing needs. But anticipating what is coming with the downturn in the economy, all the measures in that memo are things that I think have to be considered and are on the table.
Thank you, Chris.
Rob Burgess, the Wabash Plain Dealer.
Hello, Rob. Good afternoon.
Good afternoon, Governor. Good to be with you again. This is for anyone who wants to take a crack at it. I've spoken to the Red Cross, and they said that individuals who want to donate for the COVID-19 convalescent plasma program must have a test confirming previous diagnosis, and that in the future there may be ability to accept results of an antibody test, but that is not currently in place. My question is, whenever that is in place, will people who suspect they may have contracted it earlier in the year and not even known it at the time be proactively tested for antibodies? Or will it still just be the random samples?
Absolutely. We are actually working right now to figure out how we're going to make sure that that type of testing is available easily all across the state.
Nikki Kelly, Fort Wayne Journal-Gazette.
Hello, Nikki.
Hello, Governor. I kind of have a two-part question. First, I wanted to know kind of what list or database was used to contact and choose the Hoosiers. And then secondly, I was wondering if Dr. Box, sorry to bring this up again, but can you talk specifically about the kind of swabs that you guys at the State Department of Health and why the swabs that ARIA offered were not, I guess, the best ones?
You know, Nikki, I don't want to continue to address this over and over again. I feel like I've addressed this discussion. I will tell you that at the State Department of Health, The specific testing that we do through our lab partners, and they have a specific EUA, which is basically that investigational ability to use a particular test, which requires a nasopharyngeal swab. So we have been very specific to use certain types of nasopharyngeal swabs that our partners prefer. Nir, do you want to answer that?
Yeah, so in terms of the list of individuals in the state, we needed to kind of figure out how to make a list that is totally representative of everyone. And the solution that a wide range of folks from the state and from our team at the Fairbanks School came up with was ultimately to identify tax filers, co-tax filers, and all of their dependents. And in a nutshell, that was sort of the generated list from which we randomly selected people.
Yeah, and if I could, Nikki, I'll just say that in terms of the swabs, it almost sounds like Swabgate. We are very appreciative of anyone that wants to contribute or donate or help the state of Indiana out in terms of swabs or any other PPE. And we are open, we are in receipt of your generosity every hour of the day and very appreciative. And matter of fact, we will come pick it up. So we just have to find the appropriate use for the PPE that we receive. And there are different standards for gowns and gloves and swabs, A to Z. We'll make that determination, but we will put it to good use.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern.